I don't see a huge volume of people with coccydynia or tailbone pains in my practice, but there's a lot of people who have or who suffer from this problem. Unfortunately, if the problem cannot be resolved with blocks, then almost always what ends up happening eventually is patients will go and have their coccyx, these few little bones that are attached to the end of the sacrum, removed surgically. The problem with that is, most people who develop coccydynia, there's some history of blunt trauma to that area. They have all this pain, they'll get x-rayed, maybe there's a fracture to the coccyx, maybe there's not. Maybe the coccyx looks like it's not quite in the right shape, it's sort of pushed forward or something like that. And so it's always assumed to be a structural problem that the pain's coming from. The coccyx, even though it's this small little collection of bones that seems insignificant, it's a major point of attachment for the levator ani muscle group, which really is what provides the structural floor of the pelvis. So it's got a very important role. If you remove the coccyx, then you can have all kinds of horrible complications. Internal organs can herniate through that space. It can be a real disaster. There's two coccygeal nerves, one on either side, and then you have the dorsal rami of S5. And those four nerves, so there's a left and right dorsal rami of S5 and a left and right coccygeal nerve. Those four nerves exit through the sacral hiatus, which is the opening at the bottom of the sacrum, and they really provide the innervation to the tailbone area. I think in the vast majority of cases, the pain is not actually due to the position or condition of the coccyx so much as it is that these nerves have been crushed or injured during the trauma or even the repetitive stress. The diagnostic portion of it is to block above, just fill up the space of the sacral hiatus with this local anesthetic, and that will take away the patient's pain if their pain is due to injury to these nerves, or even, let's say the coccyx has been fractured or it's not quite in the right orientation. But if blocking those nerves relieves the pain, that's really the goal. You can make a relatively small incision just sort of above the area of the tailbone, and you go in and you open up the sacral hiatus and have to physically, identify and locate these nerves. And then you disconnect them, remove a section of each of the nerves, and then take the proximal ends and transpose them up into the sacral bone. And that is very effective at relieving this kind of coccydynia or tailbone pain.